This episode is based on a true story. Some scenes have been dramatized. Always consult your doctor for medical advice.
Here in the land of two seas, Bahrain, healthcare is one of the priorities in the kingdom. Health, as we all know, is important for human happiness and our well-being. And in Health Hub, we answer your common questions and bring to you information about the advanced medical facilities in Bahrain. In today's episode,
Dr. Farouk, our topic today is on back pain.
On one side, and then you do the other side.
I took a look at my back. I had 3 ruptured discs. Yeah, and a lot of pain.
So far, he cannot sleep from the pain. He cannot walk.
Virginia will need to be in a straight position.
Back pain, a very common medical problem with many treatments available for it. I am Dr. Khawla, and we have dedicated this episode to learning more about the treatments specific for back pain. So Dr. Farouk, our topic today is on back pain. Can you tell us how common is back pain?
Back pain is very common. It's estimated that about 80% of the population will get back pain at some point in their life. So imagine that 80 people out of 100 they will get back pain at some point in their life. However, the majority of the conditions or the cases of back pain can be treated conservatively, and that's what we do. We treat the patient initially conservatively, and we explain things to them and try to treat them initially with simple measures.
Very good. So then, Dr. Farouk, what are the most common causes of back pain?
Back pain can be, there are certain risks for back pain, and back pain can be related to certain habits, for example, like smoking. If you're a smoker, then your risk of getting back pain is higher. And lifestyle, for example, if you're somebody who do not exercise regularly, then you are more prone to having back and neck pain. Your line of work. For example, if you're sitting in an office and behind a desk on a computer, that's another risk factor, because you will be doing that 8 hours a day for so many days and weeks and years. And I'll explain later on to you the proper posture that you will need to do when you're sitting in an office. So these are the most common kind of reasons for back pain.
Very good. So, Dr. Farouk, if I have a patient coming in with back pain to your clinic, what are sort of the measures or the diagnostic tests to do?
Yeah, initially when the patient comes to the clinic complaining of back and neck pain, we have a good history taking. So let the patient explain their condition. And we ask about when the pain started, the location of the pain, is there any associated kind of things with their back and neck pain. For example, if you have back pain and then pain shooting down your leg, that's called sciatica. The same thing, there's a problem in the neck pressing on the nerves, then your pain probably will be shooting down your arm, because that's where the nerves are originating from. So a good history taking in the beginning, then a full physical examination. After that, there are certain kind of tests that need to be done. Sometimes the physical examination, history and physical examination, can be adequate, but in many other times, then you're going to need to have some more tests, and that include X-rays, sometimes MRIs. An MRI is a study which shows all the soft tissues, for example, discs, nerves, if there's any nerves being pinched, there are disc herniations, for example, there's a slippage in a vertebra. All that will be identified by these tests. And once these tests are done in the history and physical examination, then a diagnosis is established. Once a diagnosis is established, we know what's going on for sure, then a treatment plan is started.
Very good. Tell us then about prevention, Dr. Farooq. What is the best way to prevent back pain in the first place?
So I always stress that to the patient, and thank you for asking this question. Prevention is really key, and it's important if you make that part of your daily routine, that you stay healthy, stay fit, and do your stretches and exercise. That is your best way of staying, keeping back pain, neck pain away from you. Simple things you can do, after you start your, morning coffee or tea or drink, you will do simple stretches, simple exercises, and I'm going to also explain that to you in a minute. So that's the first thing, which is exercise and staying fit. Now the exercise are two parts. One is specific for the neck and the lower back area, and that can be done every day. And there are general fitness exercises. Those are part of your general fitness. For example, if you enjoy jogging, or you enjoy swimming, or enjoy Pilates, or you enjoy yoga, but you have to do it routinely. You have to do it minimum twice a week, probably 3 times a week for an hour, okay? But the specific exercise I mentioned earlier, the neck and the lower back, these need to be done every day.
So, Dr. Farooq, my next question is, what if a patient needs surgery? What's next, or what's that?
Well, we start usually with the smallest form of surgical procedures. These called minimal invasive spine procedures, usually done under local anesthesia, small incisions. Patients usually awake during the procedure, and a small dressing is placed over the incision site. Patient typically goes home the same day.
Wow.
And generally our patients are very satisfied with these techniques. So I can give you an example of that. We have a patient here that had a similar procedure that I just described. I'm going to call my nurse.
Very good,
Yeah.
thank you.
Hello, Mary. Can you send Nicholas, please? Thank you. Yes, come in. Hello, Nicholas.
Hey, how are you? Good to see you
Yes,
again.
come inside,
Hi,
please.
Nicholas. Nice to meet
Have
you.
a seat.
Nick, very nice to meet you.
Nice to meet you too.
Thank you for coming, Nicholas.
My pleasure.
Yeah, Dr. Khawla was asking about minimal invasive procedure, and I thought, you have something to say about that.
Yeah, definitely. Well, I had the operation done, thankfully, because otherwise I wouldn't be sitting here upright, pain-free otherwise. I came in, I spoke with him. We took a look at my back. I had 3 ruptured discs.
Wow.
Yeah, and a lot of pain. But after that procedure, almost immediately upon, coming to, almost pain-free. I could stand up straight, I could walk, completely turned my life around.
Very good.
Yeah, I owe a lot of gratitude for this man.
Very good, very
Yeah.
good.
So
Any
I'm
final-
glad about Nicholas, and we were able to help him out. But that's an example of some of the procedures that can be done. The long kind of procedures are reserved for certain situations, but minimal invasive techniques nowadays are commonplace and can help a lot of patients. And we do explain these things to the patient, and as you can see, the results are quite satisfactory.
Very good. Thank you, Nicholas, for taking the time to meet with us today. Appreciate it.
Yeah, thank you very much.
Thank you.
See you later.
See you.
Thank you. Good to see you again.
Thank you. Bye-bye.
So, Dr. Farooq, what if the simple treatments don't work? What's next?
Well, if the patient did not improve after conservative treatment, then we're going to move to the next step or next stage, which is interventional treatments, meaning that we deliver a medication right where the problem is, and usually that's with injections. So the commonest kind of form of doing that would be the epidural injections, and these are fairly routine and safe injections that give good results to the patients. There are other techniques also called interventional procedures, but I can give you an example of a patient that we've treated with interventional cervical epidural for neck pain.
Interesting.
And I can call the nurse and let the patient come in.
Sounds good.
Hello, Mary. Yes, let Mr. Abdulaziz come in. Thank you. Come in.
السلام عليكم دكتور.
How are you, Mr. Abdulaziz?
Alhamdulillah.
Thank you for coming in today.
Thank you very much.
Thank you.
Abdulaziz, thank you for coming today. Dr. Khawla was asking about your condition and the treatment you've received, the injection. So if you can describe your condition and the treatment you've had for her, I appreciate that.
Yeah, of course, this neck pain, it happened suddenly, but of course it is built up long time ago. And nearly 2 months ago, when I feel the pain, my son asked me to come to Dr. Farouk. When I came here, of course, the pain cut from the head until the shoulders. Dr. Farouk asked me to make MRI. After MRI, when I came again here, he saw the tissues of between the bones of neck too much pressed,
Right.
already pressed. Of course, this is built up from long time ago, but I feel the pain only just maybe 8 months ago, like, and the pain going up, rise up. The doctor, of course, asked me either to do operation, it will be the major for me, or injection. I asked him first, I will go to first step
Yes.
for physiotherapy.
Right.
Alhamdulillah, yani after physiotherapy, I feel better. Then after around, I think 3 weeks, I back again for him. He check up. Then he said it will be better to take injection back of the neck.
Right.
After the injection, when I took the injection, I feel more better.
So that's the kind of sequence of treatment, conservative treatment, medication, then the injection. If there's some residual symptoms, the patient did not improve significantly to the level they want, then we will go to the injections. And as you can see, that's 90% of the patient's symptoms has improved. And we try to maintain that with precautions and physical therapy kind of techniques. And I'm glad that Abdulaziz is doing well, and hopefully will continue to do well. Yeah, nice smile, as you can see, yeah.
Of course, Dr. Farouk, he asked me to return my age, to be younger.
Yeah.
But Alhamdulillah,
Yeah.
as I feel I am young. Yeah.
You are young enough. Okay, thank you very much, Abdulaziz.
Thank you
for
so
coming.
much, Doctor.
Yeah.
Thank you, Doctor.
Yeah.
Thank you.
Thank you
very
very much.
So, Dr. Farouk, then when do we need to do major surgeries for the back?
There are certain situations where there are conditions you need to do large, extended kind of surgical procedures, long incisions. One of them, for example, is scoliosis, which is a lateral curvature of the spine. And in these kind of situations, you will need to fix the spine, correct the deformity. You need to put some hardware in there like screws and rods and correct the deformity so the spine is straight again. And I I can show you the example of that. We have here Ali and Amina. Ali had his surgery last 18 months ago. He had a major thoracolumbar scoliosis of severe degree, and he went through the procedure, and maybe Amina and Ali can talk to you about that.
Thank you for having us today and accommodating us. We appreciate it, Ali and Amina.
You're welcome.
So tell us, what was life like before surgery?
It was so hard. Even in his work, he cannot work properly, and it affect his life. Even when he drive, sometimes he cannot feel. He don't have feeling in his legs.
Interesting.
Yes, very difficult to drive the car alone. I have to be with him. And in the work, because his work, he have to stand for 8 hours, and also it affect his back. And the doctor told him, and every year his back, his scoliosis has become more.
I see.
Yeah.
So
Then
he
they
had
told
to
that we
do
have to
something.
do this surgery to stop it.
Very good, very good. And tell us about the surgery. How was the surgery, days after surgery?
It's become better.
Good.
Now when he go to work, he's not feel same before.
Mm-hmm.
He feel better, and now he can drive alone. Yeah, and before there is something he cannot do it, but after surgery now it's easy to do it by himself. Before he cannot stand straight.
Mm-hmm.
He have to hold something to hold himself. But now he can stand alone.
Interesting. So before he couldn't balance himself.
No, he don't have balance.
And now he could basically
Yeah,
balance himself.
exactly.
And work is he's able to stand on his feet.
Yeah.
Okay.
He have to stand for 8 hours. It was so difficult before surgery.
Well, we appreciate your time and joining your, sharing with us your experience.
Thank you.
That's very good.
Thank you very much, Amina. Thank you, Ali, for coming.
Appreciate
today.
it.
Yeah, thank you.
So Dr. Farouk, tell us about some exercises that we can do to improve our posture.
Well, there are simple exercises other than the simple stretch exercises we all do. But one of the things that can help with maintaining a healthy back, you can use a simple exercise ball. You can get that in any sports store. And I can demonstrate that for you with Virginia helping us out here. This is an exercise ball. And Virginia, can you please sit over here? There you go. Okay. And as you can see, you can just do a rotational. There you go. So you can exercise, and that will exercise the lower back muscles, but you have to do it in a rotation, clockwise, counterclockwise, other direction. There you go. Okay. And actually, I have a friend of mine, a neurologist. He uses this as his office chair.
Interesting.
Okay, so it's also fun to kind of use. There's other exercises, and we have Meryl here to help us out. Can you stand up, please? And you can lie down, and you need to bend your knees. Bend your knees, please. Okay, and then you can tilt your knees to the side all the way until you get it as far as you can on one side, and then you do the other side. Okay, and that will exercise, stretch your lumbar and spine kind of joints. And there is the other bridging kind of technique that, yeah.
And then hands on the side, still bend the knees, and then up.
There you go.
Okay, and down. Okay, that's good. And up again. So that's it.
Okay, very good. Okay.
And how often do you do these exercises?
Generally, stretch exercises, you should have exercises part of your daily routine. I do recommend every day, since you can do them at home.
Yes.
When you wake up in the morning, after you have morning coffee or morning tea, you can do simple stretch exercises. You can use your exercise ball, and that will help you to start your day.
Yes.
And that is a good strategy for prevention, if you want to prevent back pain.
And so you should do this in a young age, starting from a young age, and not wait until the posture starts to...
That's the ideal situation, but I do recommend for any age. If you are, 80 years old or you are 17-year-old, It's just, people want to stay healthy and flexible and stay away from back pain.
Thank you, Dr. Farouk.
Yeah.
Thank you.
Virginia is going to help us out with demonstrating how is proper posture is done while sitting in an office chair. As you can see, you have, first of all, you have to adjust your height. So I'm going to lower the chair a little bit down, and then in order to be able to slide underneath the office table. And you can see she can raise her hands and reach to the keyboard, okay? At the same time, she put her feet on the platform down in there, okay? And she kicked the chair back, so you kind of lower your back, okay?
I see. So, Dr. Farouk, we always think of the right posture as sitting upright like this. That's not the right way to do
No,
it?
actually not. You should be able to kick the chair back and be in a comfortable position. So we'll try to kind of lower the chair a bit more and slide inside. And you can use a keyboard. You put your hands and in a comfortable position. So as you can see, Virginia sitting, the chair is kind of kicked back a little bit. Part of the body weight is taken by the backrest of the chair. Her elbows are on the armrest and her hands are reaching to the keyboard.
At the same level, right?
Correct. So that's called the ergonomics of the workstation, and it is possible to sit for a longer period of time without much difficulty.
That's why it's important to use a specific office chair, not like a wooden chair for the office.
No, an office chair probably should have some adjustment to it, so you can do this posture without difficulty and sit for a long time in a comfortable position. So
very good.
How do you feel, Virginia? Better?
Very good.
Yeah, very good. Okay.
Now, what about standing posture?
Okay. So I'm going to demonstrate now to you about standing. Virginia, can you stand up, please? And now I'm going to show the proper posture. Virginia, as you can see, she needs to tuck her chin in a little bit. There you go. And the back is straight in a relaxed position. And you notice that the ear is in line with the tip of the shoulder and in line with the hip and in line with the ankle. And that will make the body in a straight position, and that's the healthy way where you should stand. Also, when you walk, you swing your arms, but your posture is the same. Back pain is very common, and I do advise people to take care of their neck and their back, as it is very common. 80% of the people do have back pain or neck pain at some point in their life.
My name is Nicholas. I've been having severe back pain for probably the last 4 months. It gradually started to get worse and worse. I've been involved in a lot of sports, wrestling, go to the gym frequently, and I just hit a point, a few months ago where the pain was so excruciating that it was hard to even get out of bed. It was hard to do day-to-day activities, and that's when I figured I need to call the doctor and find out what's wrong.
He had the pain from long time. So far he cannot sleep from the pain. He cannot walk. He's affect his work, and even his life. But when they suggest us to come to Bahrain Special Hospital to see the Dr. Hamdan. We came and he told us you have to make surgery for his back.
On 2011, I was working in GPIC. That year we had a very heavy job. I tried to help the people for lifting one big gear in the fan. Suddenly I feel very heavy pain in my back.
I do recommend that people, whoever is listening, that they focus on prevention, and prevention is actually key, and it's much better than treatment.
After we did the operation, he feel better, and he can now to do that some things we cannot do it before.
By physiotherapy, alhamdulillah, the pain reduced. After 3 weeks, I returned back for him, that to give me the injection in the neck, back of the neck. After the injection, alhamdulillah, the pain more reduced.
Immediately, as soon as I had the operation, my back pain almost went from, from 100% pain, not being able to get out of bed, not standing straight, not being able to move, enjoy life, to almost completely gone. And I can walk straight, I can sit down normally, as you can see right now. I'm back in the gym, and my life has improved dramatically.
In every episode of Health Hub, our team worked hard to bring you the latest and most relevant information to your health. I'm Dr. Khawla. I hope you've had a good time with us. Take care.